In order to assess the client's active range of movement in the knee, I begin with flexion, so I ask the client to bring their knee up to their chest. And to assess abduction, I ask them to hook their left leg, the leg we're not assessing, over the edge of the bed and bring their right as far up to the side as they can. For adduction, I ask them to cross their left leg over the right and move their right inwards towards the main line of the body as far as they can. And for external rotation, I ask them to get into hip flexion again and move their feet into the main line of the body for external rotation and foot outwards for internal rotation. Throughout the active and passive assessments, I am asking the patient whether they are feeling any pain, and if they are, to rate it on a scale of 1 to 10. I then get the patient into a prone position by asking them to flip onto their stomachs and with a straight leg, raise their leg as high as they can. To assess the patient's passive range of movement, I imitate those exact movements on the client's hip myself, asking them to completely relax, allowing me to take the weight and activate the joint. For the resisted testing of flexion and extension, I am getting the patient to lie on their side, which just puts me in a better position to monitor the movement and strength. In this video, I allowed for isotonic muscle contraction as the joint had full range of movement, as opposed to isometric where there is no joint or limb motion whatsoever. I may rate the client's strength levels using the Oxford scale. Lastly, I carry out a functional test by asking the client to carry out an exercise or movement to assess both the range of movement and strength in the hip. In this circumstance, we used a squat, which requires the hip to flex.